Denial and bipolar disorder go hand in hand. To the dismay of my family and friends, I lived in stubborn denial for years. I'm sure many of you found this video because you have a loved one in denial. But what happens when someone you care about isn't even aware that they have bipolar disorder? I'm not just talking about someone denying their diagnosis. I mean their brain literally won't allow them to see the fact that they're mentally ill. Up to 40% of people living with bipolar disorder, 40% are living with a very intense condition known as anosognosia. Some may call this the ultimate form of denial, but it's actually not denial at all. I'll explain a lot more, but let's back up for a minute to the year 1914. French neurologist Joseph Babinski noticed that some of his patients were unaware of how their minds and bodies had changed after surviving a stroke. Picture someone who can't use or feel the left side of their body. It's paralyzed. Now imagine if they aren't even aware that there's a serious problem. That's anosognosia. Years later, neurologists realized that this condition affects between 50 and 98% of people with schizophrenia, and as I mentioned, around 40% of people with bipolar disorder. So what are the differences between anosognosia and typical denial? In short, anosognosia is neurologically based, and denial is psychologically based. I'll elaborate. Anosognosia happens when the frontal lobe of our brain isn't operating at 100%. Imaging studies have shown that bipolar disorder can sometimes damage this crucial area of the brain. The National Alliance on Mental Illness, or NAMI, explains it really well, and I quote, "We constantly update our mental image of ourselves. When we get a sunburn, we adjust our self-image and expect to look different in the mirror. When we learn a new skill, we add it to our self-image and feel more competent. But this updating process is complicated. It requires the brain's frontal lobe to organize new information, develop a revised narrative, and remember the new self-image." End quote. Someone with anosognosia can lose or partially lose the ability to update their self-image. Someone in denial, on the other hand, is more or less aware that there's a problem. They can consciously choose to be in denial. Typical denial is a defense mechanism where a person rejects or avoids accepting reality because it causes them anxiety or distress. People with trauma, grief, substance use disorders, and personality disorders commonly experience typical denial. I actually made a video talking about 10 ways you can help someone in denial. If you haven't seen it yet, I highly recommend it. Now that we have a basic idea of the differences, let's get back to anosognosia and bipolar. The word itself is Greek for to not know disease. Experts describe it as a denial of deficit or a lack of insight. People living with bipolar disorder are more at risk to have anosognosia if they experience psychotic features like I do. The condition can decrease someone's chances of being properly diagnosed because they can't see that there's a problem. It's also associated with a decrease in treatment compliance, like refusing medication or therapy, and an increase in hospitalizations, arrests, incarcerations, and sometimes violence. It's important to note, anosognosia is not always absolute. It can be relative to each individual. Some people are more self-aware than others, allowing them to acknowledge their illness at times, while other times they might not see it at all. Someone may even acknowledge certain symptoms, but not others. Also, anosognosia can be cyclic, similar to bipolar disorder, where it comes and goes in varying waves of intensity. All of these factors can make it harder to detect. Thus why it's so important to see a specialist and not just your family doctor. Misdiagnosis or improper treatment can make symptoms much worse. So can waiting. Bipolar and anosognosia can be progressive, where they get worse over time. Let's go over some of the symptoms. People with anosognosia will usually demonstrate that they can't recognize their problem. For example, someone is admitted to the hospital for a psychiatric emergency, and if you ask them why they are there, they might say something like, "I just came in for a rest." They can't understand or agree that the situation is dire and that they need help. They can't recognize or connect their signs and symptoms to the illness. Some people may try to cover up their symptoms or holistically avoid the truth. Other symptoms can include missing doctor's appointments or forgetting to take meds because they suddenly become unaware of their condition. They may even confabulate, which is where a person's mind fills in gaps in their memory with false memories. Diagnosing anosognosia has its challenges. If you don't have a pre-existing diagnosis like bipolar or a stroke, your doctor might not see the signs that you can't recognize the problem. In a lot of cases, a healthcare provider has to first diagnose the condition that's impacting your life so much, then they can watch for signs that you can't see the problem. Bipolar disorder already has a 40% misdiagnosis rate. It's hard enough to diagnose. Combine that with anosognosia and things get complicated. All the more reason to see a specialist. Diagnostic imaging like MRIs, EEGs, and CT scans can help show what's going on in the brain. A physical and neurological exam can help rule out many things. It's also important to examine a person's health history and lifestyle. All of these things can increase the chances of a proper diagnosis. Treating and managing anosognosia has extreme limitations, especially considering it isn't curable. Treatment approach depends a lot on the underlying condition that's causing it. If someone has bipolar, it's treated differently than someone who had a stroke. There aren't any specific medications for it. Therapy and other programs can help someone compensate for the condition, but they don't treat the actual condition. Some types of therapy may be more effective than others. Cognitive behavioral therapy and motivational enhancement therapy are showing promise. Treating the bipolar disorder first, ideally with medication, can make a big difference. But it's like trying to convince someone without diabetes to take insulin. Talk about an uphill battle. If you made it to this point in the video, thank you so much for watching. Making this video took several days of research and planning. It's a huge labor of love. My channel is completely viewer supported, which means no annoying ads, no sponsored content. Please help me keep a good thing going by joining me on Patreon. For less than the price of a fast food meal, you can contact me directly anytime, access an incredible community of like-minded people, and support my ability to make these videos. Take extra good care of yourselves, and I'll be back here soon with more Polar Warrior videos. Stay well.